Treatment of head and neck cancer can vary depending upon the site, the type of tumor, whether it's HPV positive or not, and the staging of the tumor. And basically, there are three forms of treatment of almost all cancers: surgery, radiation therapy, and forms of drugs, which could be traditional chemotherapy, there could be biologic therapy, which is a form of drug therapy, and now we have immunotherapy. So these are all advances in the treatment of cancer. By and large, surgery is the prime method of treatment for cancer of the oral cavity. And when you do surgery, especially on the oral cavity or the head and neck, there are two things to consider, and that's the function of the patient following the surgery, as well as the appearance of the patient. So those are all things to be considered to preserve that form and function. Well, radiation therapy is an ionizing beam that can be coming from an external source, such as the great majority of radiation therapy is administered, to try and target the tumor or potential tumor involvement and try and avoid the radiation exposure to normal tissues. In addition, there's been a marked improvement in the effectiveness of drugs in the treatment of head and neck cancer. The traditional form of drug is the chemotherapy, where the tumor is directly affected by the drug given, and the drug goes everywhere in the body. So if there's any tumor cells beyond the site of its origin, then hopefully it's effective in controlling that. A second form of therapy is something called biological therapy. The tumor produces certain substances, and these biologics can alter those substances to decrease and perhaps even sometimes eliminate the tumor by directly affecting it. And then the third type of drug therapy is the immunotherapy, where there is an effect on stimulating the immune system of the body to combat the cancer cells, often in a very effective way.